Hello, good evening. I'm Earl Gibbs, and welcome to Speaking of Everything. Well, this evening I have a very interesting, remarkable lady, and you're now in retirement, right?
Yes, I am.
Well, thank you for coming in, and thank you for accepting the invitation. How are you doing?
I'm fine. Thanks for having me.
You know, it's amazing because I'm sure you're retired now, but you have more work now, right?
Yeah. There's so many things that you want to do that you never had time to do when you were working. But it's also great to be able to, make time for those things now. And I'm sort of getting into my rhythm of doing the things I wanted to do. I'm not all the way there yet, but I'm getting there.
Well, you know, it's amazing because I was telling someone the other day that you're such a remarkable lady and a hard-working person. And what you've done for this island, you weren't born here, but you came here many years ago. And I really got to say to you, we really got to thank you for your service to this island because not many people have done what you've done and in terms of mental health on St. Martin.
Well, you're welcome. Thanks for the compliment. Well, St. Martin has become my home. It was not difficult for me because I was raised in Suriname, actually. So the Caribbean, it was, my place to be, I guess. I like St. Martin. I like the St. Martin people. I very much enjoyed working here through all the years, even with the confusions. Yeah. But that's everywhere. And I think my character is such that I like to solve problems, yes, and I like challenges. So for me, it was, there was a lot to be done in St. Martin. There's still a lot to be done. So, and if I get a chance to do something, I'll give myself 100%, certainly when it's healthcare. I've been a nurse for, I don't know how many years, since I was 18 years old. So, and I had a lot of opportunities and chances in life, maybe because of my character, I don't know. Some people say I am difficult, and I am sometimes. But I like to see results. I like to see that things happen, and especially for patients. I always focused, whenever times were very difficult, on why am I doing it? I'm not doing it for myself. I'm not doing it for politics. I want to better the lives of patients. And if you maintain that focus throughout your career, then in healthcare, there's so much to be done.
But did you ever imagine that your name, Eileen Healy, will be so synonymous with mental health in St. Martin and the work you've done?
No, I never. You know, it is weird. I remember when I was studying nursing in 18, 19 years old, in those days, it was an in-service program. And the men that became nurses in Holland always did the B first, which was psychiatric care. But if they wanted a career in healthcare, they had to go into, become a registered nurse, and then you could follow other studies. And they never liked it. They always preferred the psychiatry above working in the hospital and rushing and not having time for patients. And they would tell me all the time, Eileen, you should try psychiatry. It's really something for you. But working in the hospital, I liked surgery and, you know, the results of the surgery and to see the patients go home happy. I was not a type of person for internal medicine, cancer, sickness that was, you know, did not have, always have a nice outcome. So, but I never dreamt that I would end up in psychiatry till 2006, when the board of the then mental health, that board then of the Mental Health Foundation asked me to help them start it up. I told them I know management and I can help set up an institution, but I don't think I know enough about psychiatry. But we got together and we made a plan, and it worked out. It worked out.
But you know, you're very determined because had you many times in the program, and seeing how you operate. St. Martin, most of the times, they're not ready for a person like that who's result-oriented, want to see things happen. That's quite difficult sometimes to function on this island.
Well, but I think it's time that on St. Martin we start working a little bit more result-oriented because we really need it. I do believe, the patients are always very rewarding. They're certainly in psychiatry. Psychiatry is, I learned, very complex, difficult to get a correct diagnosis of a patient. The whole family is involved with the illness of that one family member, but even the jobs, the schools, it's a whole facet of things that you have to consider when you're talking about psychiatry. That is what makes it so very, very interesting. On the other hand, if you only focus on, and that was my problem over the years, the 20 years that I worked here in healthcare, with our government, for instance, their main focus is on money. And in modern management, you should focus on the product. Now, when in healthcare you say a product, it's not a business. Well, a patient is your source of income if you want to properly set up a healthcare facility. And you have to focus on what the actual needs are of those patients that you're going to cater to. If you don't do that and you're only talking about money all the time, yes, then it costs a fortune and you have no idea what it costs. And it's going to continue to cost more money. Let's take mental health, for instance. When we started it, we could not admit patients. So I started with an ambulance team, a team that would go out there, would go out and assist the police, go to the homes. The results are incredible. Even when I was working for Whitechapel Cross, I used to try to convince the board then, the AVBZ at that time, that the home care is what we should primarily develop. We're constantly talking about a hospital. Yes, we need a new hospital. But if we do not pay equal attention to the primary health care, the care in the patient's own environment, what is causing the illnesses, and what can we do in the basis, we're going to constantly be building a hospital. And I have never been able, maybe I don't formulate it correctly or something, being able to convince people on St. Martin that that is much more important than only focusing on we need a high-tech hospital that can do, yes, we need it. But we also need to prevent a lot of things, and it can be done. And in St. Martin, if we're going to talk about money all the time and that it's too expensive, what they call in Dutch mantelzorg, home care of the families. 80% of the families, maybe 90%, there's no exact research yet, do take care of their sick relative, of their elderly, and do want to take care of them still. In other countries, they subsidize families to do it. Come on. So we have to set up a system whereby we're more out there and not in a building, in an institute. In Europe, in the United States, they tore down mental facilities. They didn't build them. They tried to, keep the people in their own environment, and the results are incredible. These people can, if you look at Mental Health Foundation has today 900 patients or something, 90% is working. They're not all in that little building that we have there. They're not all in the day facility. That's only a very small fraction. And we have to keep it like that. It's the way it should be, and we should look at people as what can they do. Even you don't have to look at mental health. You can also look at a person gets a car accident and becomes disabled.
Right.
Is he supposed to stay in an institute, or can he go back and do his desk job in a wheelchair or whatever? We're not catering to that. And you know that everybody in St. Martin is insured for that by AVBZ? We're not making adequate use of that law. That was my other problem too, our serious lack of good legislation and the knowledge of the legislation that is there. The AVBZ law is a great law, and everybody's paying into it. Over the years, it accumulated a fund. It has money. It's been shared up and it's here. And we're looking at what can we do with that money. Develop primary health care, the care at home, in accordance with that law, for the people that have a chronic illness and that want to be at home. AVBZ law is there to make home adjustments, to revalidate patients, to make sure there is home care, professional home care for the person so he can stay at home. It's for most psychiatric illnesses are chronic, so you can facilitate. We used to have, for instance, on St. Martin, a social workplace. We don't have it anymore. For chronic mentally disabled or for any handicapped person, at a certain age, they have to leave Basilia Center. At a certain time, the day treatment at mental health is over, and what is next? Is the person out there? Education for nurses and caregivers. Medical center does a tremendous job. If we didn't have them, we would have a lot of problems on the island. But then the specializations into, does a nurse forever want to be working in the hospital, or does she want to do something, become a social worker, become a social psychiatric nurse? There's so much you can do that is less costly than hospital care.
You see, you have such a passion for what you do. And the thing about it is that's why I admire you and what you did for mental health and Mental Health Foundation on St. Martin. And I know you're in retirement now, but maybe we need to take you out of retirement and bring you to really help us in terms of general health care on this island. Because everything you spoke about just a while ago is so important, especially when you mentioned AVBZ and what that stands for. And the funds are there in the millions of guilders, and it's not being utilized.
Then there's another thing that could help, is what I also found difficult in working in healthcare here, but again, it was a challenge, and I kept trying things, and not everything worked. My father taught me, if 50% of the things that you try in life succeed, you're a success. So the under 50% of things that I tried really didn't work, but is to unite people. In mental health, we started, and it has articles of incorporation. Claire Elshot is the president of the Patients Care Foundation.
I called her the other day. I said, I know you're retired, but I have to speak with you. So I'm glad that she's back here this evening with us here and speaking of everything. And you were saying just before the break that we have to unify, and you mentioned Claire Elshot, and so you can continue that, please.
What I firmly believe, because we're such a small island, is that we need a total patients platform whereby patients also voice their needs. It should not only be like President Kennedy once said, do not ask what my country can do for me, but what can I do for my country? But it's so difficult to unite people here, to get them in a group together, then voice in a way that those in charge have to listen to you. The staff at Mental Health, I literally beg them to join a union. Every year, You were asking me my challenges. Every year was a challenge. Not one year was not a challenge. And I am there fighting to be able to pay your salaries. You should be out there with me. You know, every year I succeeded, so they would lay back again. Go do the nurses are the worst to get properly united. I have to say that because mostly nurses are busy with their job and their job. That's true. But if we don't do it, I know, for instance, in Curacao, they have a healthcare federation. That federation even proposes laws to government, which are accepted on occasions. Our government is often so overwhelmed with so many other things that they have to do. If we do not fight in healthcare for what really needs to happen, it's going to take a long time to happen. It'll probably happen one day.
But we don't have that person anymore. The only person I know that was really there with the passion for what they was involved in was you, and now you're no longer there.
Yeah, but I'm not a patient. You see, I started the patient platform, and I told them, okay, now it's here, it's notarized, it's everything. Now you guys got to continue, because I'm the director.
Right.
So for your voice to be heard, I shouldn't be influencing you all the time. And it's the same thing with the union. I can encourage it, which I was not even allowed to do at that time as a director.
Right.
But I did it because I also believe it is patients' rights. And one of the things I also advocated through the years that I was with mental health, it's not charity. It's nice to get donations here and there, but to provide continuity of care, you need some form of guarantee that you can continue the care, and that you can continue to pay salaries, and you can continue to innovate and start new products or redevelop products that are becoming outdated. Those things. So we have to realize that even when you unite as a platform, that it is a job. You really, so yeah, maybe now I'm an ex-patient. If enough people are interested, yeah, we could start a total patient platform, not just for mental, but in general, and then voice the ideas. I haven't really thought of that. It's now we're talking about it.
But you know, you'll be amazed because I've been doing this show now for 33 years, and I've seen people get involved and start organizations with a lot of passion and get it going. And once they're no longer there, then everything starts to crumble. Yeah. And I haven't seen that with the Mental Health Foundation. It's still going, working along, which is good.
Well, yes, of course, the foundation is a solid foundation, and I think it will continue to be operational for a long, long time and will expand. Why? One, because every job description, every document I wrote was the objective of the foundation primarily, and keep it there. So every time somebody tried to tell you you're not doing that, I say, yes, this is the objective. These are the articles, these are the rules and regulations, and that's what I'm doing. Patient care. Primarily, that is my job. Staff is secondary. I need them very hard, but they have to be qualified, they have to be willing and able to provide care to very sick people that, yes, can be verbally aggressive and physically aggressive and whatnot, but it's your job. And if you take on that job, you're going to have to learn how to deal with it. And if you maintain that focus, then the third thing is money. And then you get a problem. Yeah. Trying to maintain those focuses that are important. But in the end, you always succeed.
But you know, I remember one time you invited me to come over and see the place, give me a tour of the facility. You had just moved into that facility in Cahill. And I was very impressed. It's a quite well-run organization, and the people, the workers looked happy, the patients looked happy. It was well taken care of, very clean. I was very, very impressed. You don't oftentimes see that in facilities like that.
No, it takes a lot of hard work, not only from me. people did find me sometimes a little bit rigid in ways. But in the end, they would usually come around and say, yeah, Eileen, now I understand why.
Right.
Things like that happened. I also know, even when I went to work for Whitechapel Cross, when it was still in Front Street, most of the nurses working there were aides, had no qualifications. And they were doing things like maintaining a drip system, stomach feeding. And I stopped it right away. I said, you can't do that. Because if something goes wrong, you're not protected. And they protested it, and they didn't like it at all. And then later on, well, the patients would then go to the hospital if they needed that kind of care. And we managed to regulate it. But later on, when Tony and Brunilda started the education programs and they went to study, they would come back and tell me, gosh, Eileen, now I know why you stopped those things. I said, oh, thank you. Of course, because then so that's where educating staff constantly comes in, where it's very necessary. Yes, and you get a team, but you have to communicate constantly with them, and a lot. I would get frustrated at times when they would walk into my office again. I said, listen, we have these communication schedules. This is this meeting, that meeting, that meeting. And don't keep coming in my office because the time between those meetings is for the patients out there. And then they would get angry because I'm kicking them out of my office. I say, but all of you come in my office all the time and I can't do my work because I also have things to do. And gradually they would understand me and we would be happy together, yeah. And I had great people working for me there. It was really, and most of them local. Like I always tell everybody, mental health was not set up by me, by local St. Martin people that were born and raised here or came to live here like me and lived here for years. People that came from abroad couldn't understand how we managed to do what we did with so little.
Oral Gibbs here speaking with this young lady here, Eileen Healy, and I was saying just before the break that that you still was the person at the forefront, although you didn't start it, and that's so important because if you don't have a person like you, things don't move in St. Martin. I know you're pretty modest about it, but
I believe in a team. Mental health was something I knew we needed for a long time, even working by Whitechapel Cross. I was literally begging them to start psychiatry because the elderly, geriatric elderly, also needed psychiatric care. And at one point we had 11 psychiatric patients in mental health in Whitechapel Cross Foundation without the adequate treatment. And yeah, it's very difficult for staff, for everybody. I think Mental Health Foundation, in the last years of my career, I was so lucky with a wonderful board, both the first board with Dr. McCure and the second board with Dr. Holliday as president. I had their full support. And I do believe we did not have the corporate governance in place, but I left it with corporate governance in place, but we worked according to it all the time. I knew I could rely on them to fall back on. I had great staff, even though we had even with the doctors, we would have some good fights. We would come back, and for the patients, we have to solve the problem. And I always said it, without your team, I would have been nothing. It would not have been worth it. It's the people around you that encourage you, and also the patients.
But I'm just about out of time. I wish you could do another program like this to follow up later on. But I only have about 40 seconds. And anything else you want to add in closing?
Yes, I still believe that maybe you're the person to start the patient platform, whereby you have another body on the island that really comes up for the rights of patients on the island. I do believe we need that, yes.
And I hope that's we can call on you sometime again in the future, right?
Of course, Oral, you can always call on me. As long as your viewers enjoy the conversations we have.
I'm sure we enjoyed it. And I knew you're going to be still busy in your retirement for sure, right?
Oh, yeah, yeah.
I want to thank you again, Healy, and thank you for your service to St. Martin. You've done a great job. Right? And that's it for now. See you next time right here on Speaking of Everything. Right back, please. That's it for now. Good night. Bye.